Hey there, welcome back to the Parkinson's Disease Education Podcast. If you've noticed trouble breathing since you've been diagnosed with Parkinson's disease, you're going to want to stick around for this episode because, as you're going to find out, it's certainly not, at least not all, just in your head. Today we're going to be talking about various breathing problems that can come along with PD, and especially tying it in with what we've already discussed on the previous episodes on communication changes with Parkinson's disease regarding problems like aspiration pneumonia. So don't go anywhere. On the other side of the intro, we're going to be talking about that and a lot more. And here we go. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Welcome back, everybody. Sarah and I are back once again, and this is going to be episode number 5, which you probably already heard in the intro on our communication and changes in Parkinson's series. We're going to be covering respiratory issues. Obviously, when we talked about aspiration pneumonia in the previous episode, by the way, if you haven't seen episodes 1 through 4, please be sure to check out the playlist that is on this series, but also I'll put a link in the upper right-hand corner of the screen so that you can access at least the previous episode where we talked about aspiration pneumonia. But aspiration pneumonia is just one issue that can happen with breathing in Parkinson's. We're going to be talking about some other impairments that you can find with PD that may not be very obvious. A couple that come to top of mind for me are respiratory dyskinesia, which is an issue that can happen because of muscle control issues or even a medication side effect. You can have shortness of breath symptoms, even though you may not be truly having a difficulty. You may still be able to breathe if you can control it, but you may have a sensation of shortness of breath. Some of that could be provoked by anxiety or even wearing off of medications. And then one other additional factor could be posture affecting the ability of the rib cage to expand and not getting that full breath to the bases of the lungs. And of course, Sarah can fill us in on any gaps I missed out on with those impairments, but those are the few that come to top of mind for me. And we're going to be discussing all that first, and then we're going to be discussing treatment. So, Sarah, anything that comes to mind that I left out in that list at the beginning there?
No, I mean, you did a good job in summarizing it. But yeah, I just wanted to reiterate that a lot of people don't realize that there can be breathing issues in Parkinson's. When you think about, Parkinson's affecting muscles and movement, we tend to think about, the arms and the legs, how we move, how we, get around. But the respiratory muscles and the respiratory system can also be very much involved.
I think actually for a moment, it would be a worthwhile effort to discuss the mechanics of breathing for a moment and the anatomy of that, because I think it's important to understand that, yes, it's a muscle activation issue, but I don't feel like the visual picture may be there for everybody of just how important that is. Without muscle contraction, we literally cannot take a breath, but there's very specific muscles involved. So we have the diaphragm, which is a dome-shaped muscle just under your rib cage. For simplification, that's basically where you would picture where it is. The rib cage literally kind of sits over it. The bottom of the ribs actually kind of fan out into a shape that supports that dome structure where it fits in. So there's lower 3 or 4 ribs that kind of come down over the sides of the diaphragm. But that diaphragm, what happens is that's the primary muscle of breathing. That diaphragm has to go down. When it contracts, it goes downward. There's like a tendon in the center. So it kind of, when it shortens, it pulls downward toward your feet or toward your pelvic floor. And there's always negative pressure around the lungs. There's a small fluid-filled space between the lungs and your chest wall, and it's negative pressure. Whenever you think of what happens in a vacuum, if you provide more negative pressure, it increases the vacuum. So that diaphragm is already an existing negative pressure. That diaphragm moves down, and it sucks even further. So increased negative pressure. So what that does is inside the lungs, it creates an environment where there's even less pressure than the atmosphere outside of your body. So air literally will rush right in because that pressure difference has been heightened to the point where the air passively, almost literally passively, flows into your lungs. At the same time as your diaphragm contracts, the muscles that are in your rib cage, there are actually muscles in between the ribs that help to basically elevate and move those ribs outward and up to allow your lungs to expand fully. So those two things happen simultaneously when you inhale. When you exhale, it's basically a passive process. When you exhale, those muscles relax, and so the diaphragm will then move upward, the rib cage will move back downward. That creates actually positive pressure in the lungs relatively, slightly above atmospheric pressure, and that air will then push out. If anything goes wrong in that process, meaning you have muscle contraction issues, which obviously happens with Parkinson's, it's not that you wouldn't be able to breathe or you'll have true paralysis of muscle or true paralysis of the muscles of respiration, but you may have a weakness or a reduced contraction. So you may be breathing more shallow, not getting full breaths, and you may not realize that.
Yeah, and I think that people with Parkinson's, one of the complaints that we hear most is that they've noticed that their breathing just isn't as full and robust as it used to be, and that they're running out of air when they're talking. That's probably the number one complaint, or that speaking just takes a lot more effort. So it really can have an impact on not just communication, but also on swallow function, because of course the breath is very finely tuned with the swallow function in order to function optimally.
Right, and they have to be coordinated so that, as we discussed previously with swallowing, they have to be coordinated so that when you're breathing and swallowing, that's not happening at this. Well, basically the airway is being covered so that if you're breathing and swallowing at the same time, those pathways aren't meeting.
Right. Exactly. Yeah, and I think you mentioned it as well, that the typical Parkinson's posture that can happen, that kind of hunched over, stooped posture that's very classic with Parkinson's, that can really restrict the rib cage, which of course will affect your ability to be able to take that good fueling breath that you need in order to speak and project your voice.
Right. And again, if one of the functions of those muscles in the rib cage is to elevate them, there's no way they can fully elevate if you're already in a rounded, hunched posture. Yeah. It's just impossible. In fact, you may not be elevating them much at all if you're in that position. They may move, they just won't move in that full expansion. Something else that can be affected as well is the cough reflex. So we discussed that with silent aspiration and with aspiration, but even in a case where you may detect an irritant of some kind, whether it's congestion in the lungs or you swallow and something goes down the wrong pipe and you have the impulse to cough, that cough itself may be weaker.
Yeah, and that can really pose some serious issues if you do have something that goes down the wrong way. And we talked about, that could be water, it could be food, it could be medication, what have you. And of course, it's more the bacteria buildup in the mouth that travels with that substance that makes its way down the wrong way that is really the culprit for potentially developing into an aspiration type pneumonia. And your body's best protection against that is to cough it out. And as you mentioned, even if you're aware, even if it's not a silent aspiration, even if your body is aware that something went down the wrong way, if the cough response isn't brisk and strong and effective, you're not going to have a good chance of expelling that aspirate from the airway, which of course puts you at higher risk of something developing into an aspiration type pneumonia.
Right. And if you've had aspiration pneumonia, or even if you haven't and still have a weak cough, or you're having difficulty with breathing fully one way or the other, we're going to be talking about treatment options for that shortly. I did want to circle back around just briefly to some of the other, essentially they're like non-motor issues that can affect breathing as well. I mentioned in the beginning, folks with Parkinson's as a non-motor symptom, really it's a psychological symptom, tend to have anxiety and depression. That's something that may be there even if you didn't have clinical anxiety and depression beforehand, because of the disease process. Now, if that's the case, a lot of the anxiety that people feel, which that can be a symptom of Parkinson's in itself, or it can also be a sign. You may also have anxiety as if you're on levodopa, it may be a wearing off symptom. If you're starting to feel more anxiety when your dose is waning, you may also have a sense of decreased ability to breathe or breathe deeply when you have a waning of medication dosage as well, just because of muscle activation issues. Anxiety is something that can provoke a shortness of breath symptom. Even though you may not physiologically have a difficulty breathing, you will have that tightness in the chest, anxious, panicked sensation, and that can make you breathe less deeply. So that's not necessarily a sign that you have a true muscle impairment, even though you may have that as well, but it can come along with the territory. So it can make things feel even worse than they are.
Yeah, absolutely. Yeah, they really do go hand in hand, and one can worsen the other. You have anxiety, which makes you short of breath, and then the shortness of breath, of course, can exacerbate that anxiety.
Exactly. It kind of ties right in as a vicious cycle.
Yeah.
The other thing I mentioned earlier was the term respiratory dyskinesia. And essentially, if you think of dyskinesia, and I'll link an episode to that up top to explain what that is, there's a difference between dyskinesia and dystonia. I don't want to go into all that right now, but dyskinesia is essentially an uncoordinated or uncontrolled movement that you can't stop. And so dyskinesia, typically with Parkinson's, falls in the category of peak dosing, not always, but most often peak dosing of levodopa. You take your medication, you're at peak dose, and then you start wiggling and you can't stop. That can affect your respiratory muscles as well. So you can have like a fluttering of your diaphragm muscle almost, where you're not, it's not like a spasm, but you have this fluttering where you're breathing, even if you're taking a deep breath, it might be like you have kind of like a inability to, an uncontrolled breath, or even a quiet breathing, you might have a kind of because that diaphragm is contracting and you're not trying to do it. So that's something that it may not affect your oxygen levels, for example, but it may be an annoying symptom or something that is difficult to control as well.
And it certainly would affect your ability to speak as well, because we speak on the exhale. We have to take a good breath in order to power the voice, and then we have to have a smooth exhale in order to speak smoothly. So they certainly one can affect the other.
Well, that's astute to tie that in with speaking and vocalization, because that was something I neglected to do, but that's why you're here. So the speech is a huge part of it, because if you don't have proper breath support, as Sarah mentioned, that's exactly perfectly right about that's one of the multiple reasons you can have lowered volume of speech and lowered clarity of speech with Parkinson's. Yes, there's the vocal muscles themselves in the larynx, but breath support is a huge part of where we get our volume and clarity of speech.
I like to think of the breath as really like the fuel, the gas in your tank. And if you can imagine how would your car run if you put suboptimal fuel in your car? It would sputter and it would spurt and it would not run smoothly. So if the respiratory muscles are spasming, like you say, during that peak medication period, well, then that can really affect the smoothness of the voice and the speech as well.
Yes, absolutely. As far as actions that can be taken to help with all of this, obviously speech therapy is something we've discussed before. To pull back for a second and talk about the other symptoms of anxiety, respiratory dyskinesia, the posture issues, I'm going to put in a plug for my profession, physical therapy, because those things can all be aided by physical therapy. Because with physical therapy, or if you're not even doing formal therapy, maybe you're doing a personal trainer, or it's specifically training for Parkinson's, like Rocksteady Boxing, where you have a trainer or a therapist who's leading you through a group program. Exercise is hugely beneficial for these issues because it can help with the anxiety and depression. because it helps to increase dopamine and serotonin to do exercise. Um, it can also increase acetylcholine as well, but specifically the serotonin and dopamine, even just cardiovascular exercise without weightlifting or doing anything super intense, can help
Mhm.
with those two neurochemicals that we need. So that can help reduce anxiety. It can also help regulate things like the dyskinesia. And also, when you're exercising, your oxygen demand is higher, so you're going to be naturally taking deeper breaths. And physical therapy programs designed for Parkinson's are specifically going to address posture as well. So
Yeah.
LSVT big in particular is great for that. And I don't want to leave out power moves either, because that would address posture as well. But specifically, one of the things that we wanted to discuss, well, two things really, but one of the things that we wanted to discuss as a treatment specifically for breathing and for the muscles involved in breathing is respiratory muscle training. And then I believe we wrote down something called EMST, and I don't recall what that stands for, but
Yes.
RMT I am familiar with, but not EMST. So I'd like, Sarah, if you don't mind, would you mind distinguishing those two?
Yeah. So RMT is just simply the global term for it. So respiratory muscle training. And then EMST is specifically expiratory muscle strength training. So you're
Okay.
specifically working on the breathing out muscles, which the research shows is the one that's most important as far as the breathing, the swallowing, the coughing, all of that. So it's essentially a little device. There's one called the EMST 150 through a company called Aspire. And that one has the most robust research behind it, specifically in the population of Parkinson's.
Mm-hmm.
So it's a little device that is spring loaded, and it's essentially a breathing resistance device. So you're exercising the breathing out muscles, which of course we talk on the exhale and we cough on the exhale. So this little device, when used as indicated, and there's instructions and video tutorials that go along with it, can be really, really beneficial. The research is showing that it can really be beneficial in improving vocal loudness, respiratory drive, strength of cough response, which in turn is protection when you're swallowing, reduction of aspiration, and all of that. So there's a guide when you first get one of these devices to teach you how to set it for your ideal starting resistance, which is essentially you twist it until you cannot breathe through the device, it's blocked, and then you crank it back sort of a quarter turn,
Uh-huh.
so that you're getting that resistance. And then as your respiratory strength improves, you increase the resistance so that you're basically increasing the muscle load of the exercise. Just something to mention that before going ahead and using or purchasing one of these devices, you always want to get clearance from your primary care physician. There's not many contraindications to using them, but there are a couple of contraindications. So you want to make sure that you've been given the safe go ahead from your healthcare team that it's okay for you to start one of these EMST devices.
That's a great point you make. As far as respiratory muscle training, one of the distinctions that I could add, as opposed to EMST specifically, is RMT can work on both directions,
Mhm.
inspiration and expiration. One of the devices, at least in the US, that's most common with that is called the Blue Breather.
Yep. That's the one I was just going to mention. Yeah. Yeah. Works on
Yeah,
both.
yeah, it works on both, and you can add that resistance wherever it's needed in either
Yeah.
direction.
Yeah.
There's a lot of scenarios where you might need that. Conditions like COPD or congestive
Mhm.
heart failure, where you have a volume issue because of fluid
Yeah.
around the lungs, things like that. Really, any kind of obstructive issue. Let's say emphysema is a condition where you have difficulty breathing outward, not just inward. So
Mhm.
you can work on both directions. And so, without going into all the detail on those conditions, uh, with Parkinson's, this can be effective as well, and you may need it for both directions. So it would be up to a speech language pathologist to assess, determine, well, is your impairment really with exhale? Is it with both?
Yeah.
Or would it benefit you to do both? Because I think, in my opinion, it would. Just thinking about the fact that inhalation can be an issue or inspiration can be an issue in itself, just getting that full volume of breath. Anyway, that's an option for sure. And the Blue Breather is available. I'm not advocating you do this, but I know that for sure the Blue Breather is available on Amazon. But the thing is again, that caveat needs to be, number one, you need to be cleared by a physician to
Mhm.
use these devices, because I have literally seen people recommending that you go
Yeah.
on Amazon and buy these devices and start using them. Do not do that. you it's sort of like when we talked about with aspiration pneumonia, and oral care. If you brush your teeth, or sorry, if you have an aspiration event and you're 20 with no other healthcare issues, no other underlying health problems, you know, you're probably not going to have an issue. So if, like, me at 40 years old with no health conditions tried to use the RMT device, like the blue breather, I'm probably not going to injure myself.
Yeah.
But if you have chronic health conditions of any kind outside of Parkinson's disease, so like some of the breathing problems I mentioned, COPD, heart conditions, even it could be blood clotting conditions. There's all kind of issues
Yeah.
that could cause a big problem if you try to use these devices without professional guidance. So
Absolutely.
do not do that. You have to get clearance from your physician, have a speech language pathologist assess your need for the device. Don't just go off of the collective whole advice, which, again, there's good intentions behind, you
The
know,
hive mind on Facebook and
yeah,
Amazon.
as we termed it, the hive mind on Meta. But yeah, there's a benefit to that community, and they want to support you, so they're not trying to do anything harmful, but
Mhm.
they don't always know what the best thing is for you.
And everyone's an individual, and everyone has, different medical history, a different tolerance. Yeah, I think anytime you're starting any kind of therapeutic program, exercise program, it's always good to get that clearance from your healthcare team, just to so you can move forward with confidence.
That's the thing is, too, is just to talk about my profession again for a moment. Not everybody is a candidate for LSVT Big, for
Yeah.
example.
Yeah.
It's a fantastic program. It has absolutely the best evidence available
Hmm.
to support improvements in Parkinson's motor symptoms and impairments, but it's not a fit for everybody.
Yeah.
And there's multiple reasons for that. It could be cognition, like you can't understand what's, the instructions. It could be, which that's another issue that could go into using a breather device.
Yeah.
But cognition, it could be physiological limitations. Like I've had patients that have underlying health conditions like COPD, high blood pressure. There's all kind of different conditions where, um, or even just Parkinson's related fatigue. And, you try to do 8 repetitions of an exercise and they're done after
Yeah.
2 exercises. So you may have to do 4 repetitions, or, whatever. And sometimes you have to do traditional therapy, as I
Hmm.
call it, building the foundation, because some people, in my can in my world, I look at it as you have got 2 different types of Parkinson's clients. You've got one Parkinson's client has a strong foundation. Maybe they're already pretty active. Maybe they already exercised before they were diagnosed with Parkinson's, or they just generally have a good constitution. They have a good foundation to build on. An LSVT Big, for example, can be what you build on that strong foundation. But some people,
Hmm.
they have a cracked, unstable foundation, and they
Yeah.
need to be shored up
Yeah.
before you can build on it.
Yeah.
So,
That's a really good analogy.
yeah,
Yeah.
and that's what I like to use for the physical aspect of helping people with movement, strength, balance, all that with Parkinson's. So,
Hmm.
but you can think of it that way with breathing training and therapy for that as well.
Yeah, there is no one size fits all. Every person is different. So yeah, it's a very individualized approach, I think, is always best.
Well, I don't think there's a whole lot more to say about this subject, but it certainly is interesting to me. And I hope at least that those of you watching and listening to this will find it to be something that you may have learned from, haven't really considered before. And that's part of the reason we're doing this, is because this isn't common information necessarily, and it's
Mhm.
certainly not information you're going to hear in your first neurologist appointment or even your 15th. so, um,
Very true.
so we do hope it was valuable. Anything else you would add before we wrap this up?
No, just if you do look into one of these respiratory training devices and are given the go ahead, it's a great tool, if appropriate, to add to your toolkit alongside of all those other things you're doing, whether it's direct voice therapy, whether it's home practice, voice training at home. Whether you're part of a Parkinson's singing group online, I just think the more tools you have in your toolbox, the better.
Absolutely. This is also something that is and can be discussed and learned about in Get Loud, Stay Loud as well, correct?
That's right. The program Michael's mentioning is the program that I run every single day. It's tune in and follow along live or on demand classes specifically for Parkinson's disease, where we target all of these things. So it's something that we certainly let all of our members know about as a good add-on to their daily voice exercise.
I'm going to leave a link in the description to explore Get Loud, Stay Loud. And we're not going to talk about it more this episode, but tune in for episode number 6. And we're going to be discussing ways to incorporate these kind of techniques into daily practice, how to build habits that will support helping with these issues for the long term. That concludes this episode. Thanks, everybody, for watching and listening. I hope you've enjoyed this. If you haven't subscribed to the channel or followed the podcast, please do so. Leave a review if you're able to do that. We would appreciate it. And as always, be empowered. Catch you in the next episode.